My doctor recommends thyroid testing. What does this mean? The thyroid is a small butterfly-shaped gland located in the neck. It's important in maintaining the body's metabolic functions. It does this by producing two hormones, the triiodothyronine or T3 and thyroxine or T4. The production of these hormones is in turn controlled by the thyroid stimulating hormone or TSH released by the pituitary gland. When the thyroid levels in your body are low, it's known as hypothyroidism. The most common cause for hypothyroidism is an autoimmune condition in which your body produces antibodies that destroy the cells of the thyroid gland. Some common symptoms of hypothyroidism are excessive tiredness or lethargy, weight gain, constipation, irregular menstrual periods, loss of sex drive, hair loss, or dry and itchy skin. Sometimes you may not experience any symptoms but still have lower than normal levels of thyroid hormone known as subclinical hypothyroidism. Not everyone undergoes thyroid testing, but if you've been having trouble conceiving, if you've recently suffered from a miscarriage, if you have a family history of thyroid disease, or if you present with symptoms that might be suggestive of thyroid diseases, then you might be a good candidate for thyroid testing. The most common test for thyroid is the thyroid stimulating hormone or TSH levels. When the TSH levels are elevated, it means that the thyroid gland is not producing enough thyroid hormones, and in response to this, the pituitary gland is producing more TSH in order to bring the thyroid levels back up to normal. So how does this affect fertility? Hypothyroidism negatively impacts both your fertility and your pregnancy. It affects fertility by preventing ovulation or the release of an egg from the ovaries. Normally, a single egg is released about once every month during a menstrual cycle. Women with hypothyroidism may release eggs less frequently or not at all. In women that do get pregnant, hypothyroidism can affect the development of the fertilized egg or embryo and increase the risk for miscarriage. Untreated hypothyroidism during pregnancy can result in premature birth, low birth weight, and affect the brain development in the baby. This is why thyroid testing is important both when trying to conceive and during pregnancy. Hypothyroidism is most commonly treated with medication. Once you do start medication, it's important to get tested every 4 to 6 weeks to make sure you're taking the right dose. So in summary, low thyroid levels or hypothyroidism can negatively impact both your fertility and your pregnancy. Thyroid testing while trying to conceive and regular testing after getting pregnant can help determine the optimal medication dosage for you and help improve pregnancy rates and outcomes.